With the COVID-19 virus and the pandemic that we've been going through, some really exciting news, local news with Spectrum Health, the use of plasma therapy to treat COVID-19 patients. And the lead doctor, the infectious disease specialist, Dr. Gordana Simeunovic, is my guest. And Dr. Simeunovic, thank you for joining me.
Thank you, Andy, for inviting me.
This is really exciting when I got the news release just recently about the plasma therapy. Let's start from the beginning, first of all, the convalescent plasma therapy that you're using. What is that exactly?
Convalescent plasma, actually plasma first, is the liquid part of the blood that contains some proteins and also antibodies. Antibodies are type of the protein that we produce when we come in touch with virus. That's how our immune system responds, trying to defend us from virus. These antibodies are interacting with virus and trying to eliminate that from the human body. Antibodies also decrease inflammation in our body, and they help us to fight infection.
Okay.
After we recover, these antibodies stay in the blood, in plasma, in the liquid part of the blood. And our thoughts are, if we transfer antibody from the plasma, with the plasma, from the patient who recovered to the patient who is actively sick, this antibody will help our sick patient to recover from the disease, to fight the virus.
This is a tremendous a possibility. It's been used in for years in fighting other infectious diseases, right?
Correct. It was discovered, actually, I believe, 200 years ago.
Wow.
Then it had used early in the 20th century for Spanish flu, mumps, measles. And somehow, for years, for decades, it was pushed back. It was left on the margin, at the margin.
Mm-hmm.
Then, in 2009, when we have pandemic of H1N1, it was used again.
Okay.
And again for Ebola and MERS. MERS is actually from the same group. That's the type of coronavirus, sister or cousin to COVID, and the results were good. Now, when coronavirus appeared, since there was no vaccine, and it's going to take probably a year to get the vaccine set up,
mm-hmm.
there is no efficient treatment. We kind of turned back to plasma. It seemed kind of logical and natural to try to treat coronavirus with plasma.
How long have you been working on this for COVID-19 then? How long have you been testing it?
We started looking our options, I would say probably 3-4 weeks ago, as when everybody else in the country started.
And you've treated now how many patients?
Actually, as of this morning, we have 7 patients treated.
Oh, fantastic. Now, and were they, well, let's talk about are there any results, or are you seeing positive signs that it's beginning to work?
So the results it is still too early to say it works.
Okay.
Patients are recovered, but I am really optimistic about this. All transfusions. First, I would like to say that transfusion is given to critically ill patients. Those are patients who are on ventilators in intensive care unit, very sick.
Okay.
All transfusions went very well. We didn't notice any side effect. We didn't have any single side effect or complication during transfusion, which is very encouraging. This is not dangerous, and our primary goal is not to cause any harm to our patients.
Right. So that right now you're seeing positive signs, like their vitals are improving a little bit? Correct.
They are improving, but it is too early to say they recovered.
Okay.
All of this has been done within the last week, so
Yeah.
Time will tell how efficient this is.
Is there a timeline? I mean, another week and then you'll be able to really say, yes, this is working?
But probably we will see better during the week how our patients doing, if they're getting extubated. Again, I really don't want to get too excited now, but I'm seeing encouraging signs.
Okay, all right. Let's talk about the donor, because the one who has recovered from it, the COVID-19, then they go. I know you've been in collaboration with the Versiti blood centers, so they can go and donate their blood plasma. How many patients would a donor and their plasma be able to treat?
So, donor can donate. Usually donates 4 units per donation, and these 4 units are enough to treat up to 4 patients. And again, donor can go back on a weekly basis to donate again.
Oh, really? Okay. So every week they could go back?
Correct.
Finding the donor. I'm sorry, go ahead.
You can save 4 patients per week.
Oh, my. I mean, that's astounding. And that's one person. But are you finding people coming forward to become donors?
Actually, the more people learn about possibility, better they respond. We are trying in this point just to inform all survivors that there is possibility that they can help the others. And I would like to use this opportunity again to remind everybody that this is a difficult situation and we can go together through this if we help each other.
Absolutely.
When we recover, we are feeling good, and frequently we forget what it looked like when we were sick. But we should remember that our family members, our neighbors, co-workers, anybody can get sick. And this is really minor thing that we can do, and it can have huge impact on the community, on others' lives, and on this whole pandemic. This can help this pandemic to end quickly.
Talking to Dr. Gordana Simeunovic, who's infectious disease specialist at Spectrum Health, and their work now, the collaboration with the Versiti blood centers for the convalescent plasma therapy that they're doing for COVID-19. What about finding the donors? I mean, we're hearing so many people are asymptomatic. If you don't qualify to get a test, there's so many people that are untested that could be potential donors. Wouldn't that be right?
You're right. At this point, these patients are not able to donate because we don't know if they really had disease or not. But we are working on getting antibody tests that we will draw blood, test blood, and confirm if there are antibodies present in there. This has been work in progress, and we are expecting antibody tests to run very quickly. We are talking about a day.
Oh, fantastic.
We'll have much more donors, much more possibilities there.
Absolutely. If they could get tested. But I've talked to other people who had some of the symptoms, felt that they may have had COVID-19, but couldn't be tested because they didn't qualify, so to speak. So you're saying that eventually some people could go back and get tested?
Correct. Antibodies stay in the blood for a long time. And actually, when we test blood, if I was sick months ago and I've been feeling well last 3 weeks, if I had coronavirus, I will have antibodies present in my blood to prove that.
And then you can identify that, and they could be a plasma donor. And think of the lives that people could save if they would come forward with that. Is there a place to go, someone to call, a website to go to start that process of maybe being a donor?
I would encourage everybody who is interested to email us. Email is COVID-19research@spectrumhealth.org.
Mm-hmm.
So COVID-19research@spectrumhealth.org, that's correct. And there are information on our website. If you're interested to donate, please just let us know. We will take care of everything. We will guide you through the whole process, and it will probably take 2 hours of your time to complete everything.
And to save at least 4 lives a week, 2 hours is not a lot of time.
I agree.
Dr. Gordana Simeunovic, our infectious disease specialist at Spectrum Health, I can't thank you enough. And my goodness, very exciting. Keep up the wonderful work, and I can't wait for your next revelation that you are able to tell us.
Thank you, Andy. Have a great day. Andy, have a great day. Andy, have a great day.